Hello, and thank you for joining me today. We will be learning about fetal alcohol syndrome and its effects on development of an individual. We're here in this special education classroom where many kids, including some with fetal alcohol syndrome, receive services. Fetal alcohol syndrome, according to Rhea Paul, is a syndrome which was scientifically recognized in 1974, involving birth anomalies associated with excessive alcohol intake during pregnancy. Fetal alcohol syndrome is the most severe of the fetal alcohol spectrum disorders, though the term fetal alcohol effects is used for individuals in whom not all of the marks of fetal alcohol syndrome are present. Fetal alcohol syndrome is the #1 cause of mental retardation in the United States, although it is completely preventable. The exact number of affected individuals is hard to determine, but it is estimated that fetal alcohol syndrome affects between 1,000 and 6,000 babies each year in the U.S. Fetal alcohol syndrome is the result of alcohol exposure to a baby in utero. Prenatal exposure to alcohol has physical, cognitive, and behavioral consequences. A number of factors determine the extent to which the child will be affected, including age of the mother, amount of exposure, and whether other teratogens such as tobacco or illicit drugs are also present. There are many long-term developmental effects of fetal alcohol syndrome. We will begin today with the biological effects. These include, according to Hagerman, babies born with fetal alcohol syndrome are often marked by low birth weight, failure to thrive, delayed development, and facial malformations. The areas which are affected depend on the gestational time in which the exposure happens. Davis tells us that early exposure results in morphological abnormalities, while later exposure affects growth. Alcohol exposure affects the central nervous system at any time throughout the pregnancy. Several physical abnormalities mark the presence of fetal alcohol syndrome. We will look at this graphic for detail. First, the area between the upper lip and the nose, called the philtrum, is flattened. The eye openings, or palpebral fissures, are small, and the eyes are set wide apart. Other things include small head circumference, malformed ears, which can affect the hearing of the affected individual. This is due to damage to the brain, along with nerves and structure of the ear. Brain scans and autopsies of affected individuals reveal reduced brain size. They also show absence of white matter in the brain. White matter transmits signals from one region of the brain to another region of the brain. According to Davis, studies have shown that some brain regions are more sensitive to alcohol exposure than others. Hagerman elaborates that the region most severely affected is the anterior region, responsible for attention and alertness. Other malformations include those to the renal system, such as the kidneys, the bladder, and the genitals. Central nervous system damage is also present, and there is often visual impairment due to malformed optic nerves. Psychological effects of fetal alcohol syndrome include increased risk of depressive disorders for those both in childhood and later in life, increased risk of substance abuse of the individual, psychopathology, which Davis tells us causes behavioral problems which reach into adulthood and often result in adverse life outcomes. Other effects include cognitive effects, such as low cognitive ability causing decreased school competence. Interestingly, children with prenatal alcohol exposure, when compared to children with low IQ and no exposure, still rank lower in intellectual functioning. This is according to Davis, 2013. These children also have low IQ. visual spatial deficits, which is defined by visual memory and the ability to organize visual information into meaningful patterns. Learning disabilities, language deficits, which according to Davis include deficits in expressive and receptive language and verbal processing. Low learning memory, attention deficits along with hyperactivity. There are social consequences as well. These include increased externalized behaviors, low social functioning, aggression, delinquency, and trouble with the law, need for special education services. Spiritual effects include feelings of isolation of the individual, feelings of failure, and hopelessness. The system around the individual is also affected, including a need for many special services. These people express aggressive behaviors, psychological difficulties, increased stress level for the family around them. Also, interestingly, the postnatal environment can affect the outcome for a child. Those who have a more stable environment have fewer negative outcomes and are better able to make up growth deficits, whereas children whose postnatal environment is still disordered seem to have a cognitive deficits exacerbated and continue to have growth deficits. In conclusion, we see that fetal alcohol syndrome is completely preventable. Education is essential for the prevention of future cases. Fetal alcohol syndrome affects all areas of development, including cognitive, physical, and social development, and has serious consequences for the affected individual. For more information on fetal alcohol syndrome and to get support, go to the National Organization for Fetal Alcohol Syndrome website at nafos.org or the Fetal Alcohol Syndrome Family Resource Institute at fetalalcoholsyndrome.org.